Good morning, Peter Goertz. I'm a psychiatrist. Prognosis in medicine. Our words as doctors can have profound effects on patients. Same with our beliefs. If we believe someone is a hopeless case, the patient likely will pick up on that, and that can affect their prognosis, in my opinion. Our actions, similarly, can have major effects on patients. Let's say if we feel someone is a hopeless case, then we may see them very infrequently, only for brief appointments, like 10-minute appointments. And that, of course, can also be felt by the patient. So on the other side of the coin, if let's say someone has schizophrenia and we feel, wow, they're dealing with some issues that may be best addressed in psychotherapy, but they don't necessarily want or need ongoing psychotherapy, we may want to schedule a 60-minute appointment to see that patient with schizophrenia. And just that in itself may make them feel respected and like we're paying attention to what's going on in their life. And that can probably help their psychosis. If someone is being diagnosed with cancer, so if a doctor is sitting with the patient and tells the patient, you have cancer, the statistics will show very different things for different patients. So a certain amount of patients may die within 1 month. Other patients may die of so-called natural causes 40 years later and may even be healed. So there may not be a trace of cancer anymore. So statistics can have a very wide variation. And if we sit down with a patient and say, there's a 25% chance you're going to die within this year, we can say that, but again, it's statistics. So my opinion is it's worth giving the patients hope. And it's important, and it can also affect their illness in a positive way if they have hope. Similarly, in psychiatry, if someone has schizophrenia, major depressive disorder, bipolar disorder, PTSD, the statistics may show a certain amount of patients die by suicide within 1 month. Other patients may have a stable mood long-term and may even have resolution of the disorder, maybe even without medication. So again, a wide variety in statistics of the various patients. So to put it simply, statistics are one thing, individual patients are another thing, and statistics may not be that meaningful for an individual patient sitting in front of you. And again, we don't want to give them an impression that it's very likely they're going to die within a few months. If it's what the statistics say, we can say a certain percent of patients will die in a few months, but we still, again, in my opinion, we want to keep hope, give the patient hope that it is possible for them to do well. Now, another thing is, in psychiatry especially, there can be a good chance of misdiagnosis. So if we're diagnosing the patient either wrongly with a physical condition or with a psychiatric condition, that of course can affect their prognosis. If we're giving them the wrong diagnosis, we're going to give them, if we give a prognosis, we're going to give them the wrong prognosis. So we want to be very careful, especially in psychiatry, where misdiagnosis is quite frequent. As an example, a patient of mine was diagnosed by another psychiatrist with bipolar disorder, but in my opinion, that was not correct, and I may be correct with that opinion because now, years later, the patient is not on a mood stabilizer. She was actually given an antipsychotic as a mood stabilizer, and now she's only on a reasonably low dose of medication for sleep, not on a mood stabilizer, and doing quite well. That doesn't mean she has no challenges, but I do not think she's bipolar. So When we give a prognosis, before we do that, we want to make sure we have the right diagnosis. And if an individual patient asks what their prognosis is, we want to, again, that's one major issue I'm focusing on in this video. We want to leave some room, at least, for hope. And you could say, what kind of nonsense is that? This guy is telling us to give patients false hope? I don't think so, because again, statistics show a large variety of outcomes, and there can be people pretty much with any condition who do a lot better than other people with the same condition. So we want to be very careful with what we say when it comes to prognosis. So if a doctor tells a patient you have a lifelong condition, let's say bipolar disorder, and there will not be resolution, that in itself could lead to the patient losing hope. And that's kind of the opposite of a placebo effect. So if you want to put it in an extreme way, the doctor might be hypnotizing the patient to give up hope of resolution of the condition. And on the other hand, doctors can hypnotize patients for good outcomes. There's one example I remember when I was at an APA conference. I was taking a course in hypnosis many years ago, and the Dr. David Spiegel, so the son of another famous psychiatrist who worked with hypnosis. David Spiegel was the son of Dr. Herbert Spiegel. Anyway, Dr. David Spiegel was presenting a course on hypnosis, and he was giving an example of a patient, a pregnant patient, whose child was in a breech presentation in the womb, but with hypnosis, that patient apparently was able to change the presentation of the child in an advantageous way. So again, we can influence patients in a negative way when we talk to them, or we can influence patients in a positive way. We want to be careful. And anyone's beliefs are very important. So let's say if the LSU football team runs onto the field believing they're going to lose the game, they're playing, let's say, on a Saturday, a big game, and they run onto the field believing they're going to lose, it's quite possible they are going to lose then because of that belief, which can affect the way they play, their actions. And similarly, when we as doctors or psychiatrists prescribe medications or do psychotherapy, if our beliefs are not helpful for the patient, let's say we believe a patient is hopeless, the psychotherapy we're doing is not going to help them, the medications we prescribe are not going to help them, that may well affect the prognosis in a negative way. So just by the attitude that we have, we can affect the prognosis, in my opinion. And similarly, not just with patients, but if we think a medical student or a resident or our son or our daughter is never going to amount to anything, they more than likely are going to feel that attitude and maybe develop a feeling of hopelessness of their own. So in an extreme situation, let's say a father tells his son constantly, you're never going to amount to anything, you're stupid. Gradually, the son becomes marinated in that belief and may not even believe they have the potential to go to college. So that can have major effects on someone. So our own beliefs, attitudes, words, actions can have profound effects on others. If we're burned out, feel a lack of purpose in our profession, feel like what we're doing as doctors is not having much of an effect, not having much of a positive effect on patients, that of course in itself can affect the patients. And in order to avoid that type of situation, it's really important for us, easy to say, of course, but it's really important for us to be in touch with our emotions. Thank you.